A person can develop swallowing difficulties or dysphagia due to medical conditions such as motor neuron diseases, for example ALS or Lou Gehrig's disease, or stroke, which cause the part of the brain controlling the swallowing reflex to be affected. In some cases of end-stage dementia and Alzheimer, as well as in certain cancer or from the side effect of the treatment during the cancer treatment. My mother had dysphagia due to end-stage Alzheimer, and I've written blog posts and published videos related to learnings of my experience in placing her on nasogastric tube feeding. As the condition of dysphagia is the same between an Alzheimer and someone with stroke or motor neuron disease, I would like to expand on this topic to be able to benefit more people due to the experience that I've had. As now I have been taking care of my mother for more than 7 months when she's on tube feeding and have a lot of phlegm and mucus built up. I will cover this from the aspect of a person with dysphagia, with swallowing difficulty who have already been placed with a feeding tube. Choking is a real danger and hazard that comes with dysphagia. Often they choke on their mucus, saliva, phlegm, or aspirated food. Now for the food portion, the danger of choking from food, we can manage it by ensuring that they remain in an upward inclined position of minimum 30 degrees, and it's preferable if we can get them to be in a fully seated position for at least 30 minutes. We can put them to sit down to watch TV or their favorite programs to help pass time. The second thing is we should also make sure that we do not overly feed them and adhere to the feeding schedule that is actually prescribed by the dietitian or the healthcare professionals based on the feeding schedule, the duration, as well as the amount maximum per feed that we can give them. For example, in the case of my mom, the senior nurse and the dietitian said that my mom has to be fed 4 times a day at 6-hour intervals. And before feed, we need to aspire the stomach contents via a syringe to check on if there's any food remaining undigested from the previous feed. If there's undigested food, it should not exceed 40 ml. We also need to return the contents of the stomach and do not throw away, because if we throw away, it may upset the electrolyte balance of the digestive tract. Each time the tube feeding food given, after if everything is okay, we give the tube feeding food, it should be about 300 ml of food. Then after the food finishes, if there's any medication that mixed with a bit of water, we put in the medication. Plus, finally, once everything is finished, we pour about 50 ml of clean drinking water to help rinse off the tube after the feeding, so that the sediment of the feed is not being left in the feeding tube that goes to the stomach. There's a YouTube video that is very helpful, published by a hospital in Singapore, which I'll link it in the description box below, that it will make you understand how to perform the feeding via the for nasogastric tube feeding. With this precaution, we can actually minimize the risk of choking from aspirated food. Next, we will address the danger of choking from their own saliva, phlegm, mucus, and secretion. This is what I feel is the real danger, because this choking episode cannot be predicted. We do not know when they will come. It will happen suddenly. There will be breathing and suddenly something will get stuck and then they will start choking. It can be any time. But I usually notice that they happen more frequently at night, in the case for my mother. Now, I have known of 2 cases of person who went on nasogastric tube feeding. They were placed on the tube feeding not because of Alzheimer, but because they have a compromised ability to swallow as a result from stroke. Now, when a person have dysphagia and increasingly could not swallow, we also always have to keep in mind that they also have problem getting rid of the secretion in their mouth and throat. For most of us, for you and me, if you have phlegm and saliva, we would either swallow or spit out the secretions. But when a person loses the ability to swallow well, they lost the ability altogether, they could neither swallow to the stomach or spit out their mucus and phlegm. Any attempts that try to move their secretion will easily cause it to aspirate and move into the lungs instead. We can also understand this condition. Sometimes if you have experienced coughing for a long time, you cough and cough for weeks and about a month until you really have no more energy and the phlegm is thick and gluey. Even a normal person will have problem getting rid of phlegm that is thick and gluey. And if you notice in your loved ones who have the dysphagia, the problem is with this thick and gluey phlegm, they tend to produce a lot of this. There are things that we can do to manage the situation, and this is based on my own experience. Number one is to purchase a phlegm suction machine. Nowadays, they sell the mobile phlegm suction machine which you can use to do the phlegm suction. Get a good machine, means get the pharmacy to recommend a good machine. I have bought the first machine, it was no good, it didn't have strength to suck out the phlegm. I can feel the phlegm is there and yet it doesn't suck out. So I actually paid more for the Fresco brand, which is a Taiwanese brand machine, which costs a few times more than the cheap machine that I had, but could do suction very well. I have done a video on phlegm suction based on my own experience, which I will refer in the description box below. Number two is to purchase an oxygen concentrator. During choking episode, because of lack of oxygen, my mom's lips will actually turn grey as she struggled to breathe, but due to from the phlegm or mucus that got stuck in her passageway. The supplemental oxygen is very important to help them to recover their energy and help to give them oxygen. So during the choking episode, I always will put in the oxygen for her. Number three is to change to a hospital bed. When a person have limited mobility, if your loved ones have difficulty moving or unable to move on their own, a hospital bed is very useful because we can adjust the incline from lying down to a seated position. As well as we can make the bed higher or lower to help us, like for example, if we need to change their diapers, then we raise the bed a bit higher so that it's easier on our back when we do the change, or when we need to transfer them from the bed to the wheelchair, then we lower the height of the bed so that it's easier for us to move them, and so on. So this hospital bed will enable us to adjust easily. At the same time, they also have the safety railing, so it reduces the risk of falling off the bed. Because sometimes, right, when they don't have when their muscles are weak, and sometimes they can still move a little, they may move and then they may fall off the bed. So it's important to have the railing. I've read cases of many old people who actually fall off the bed. So the railing is very useful. You have it up with them on all times so that it prevents them from falling off. And it also will help the bed, in the case of bedridden patients, right, we can place them on an upright incline position for at least 30 minutes after each feed. If you try to prop, I don't really like propping with pillows because sometimes the pillow will go off balance. So having the incline on the bed will be better. Now, what to do during choking? I have experienced a few times with my mother having choking episodes. And each time it happens, I immediately get her to sit upright. I will hit her back. I will bend my palms, and then I will hit her back with my curved palms so that it will trigger her coughing, because she can still cough, but it's very weak. I think in cases of like ALS patient who loses the ability to cough altogether, they will use a cough assist machine. Immediately, I will also perform phlegm suction, and I will aim the suction catheter towards her lung passageway, because there is a two passageway. One is going to her lungs and one is going where the tube goes to her stomach. So I'll aim the suction catheter towards her lung passageway and I'll do the suction. Normally when she chokes, because my mom can still cough a little, can still cough but is weakened. During each of these choking episodes, a lot of the mucus and secretion from the lungs are being pushed upwards. So that is the time I always do the phlegm suction. And these machines, the oxygen concentrator and the phlegm suction machine, are located near her bed so that it can be turned on and used immediately when there's emergency such as this. Usually when we care for somebody with this condition, if they are more bedbound, we also need someone to help us, because when raising them to a seated position, when the body will normally tense up when they choke. So having another person which you can call for help would help you to manage the situation better. In future, I will be doing more topics, more videos to cover the topic related to dysphagia, tube feeding, and also the precautions we take based on the experience I have for other form of illnesses, because the condition, as I mentioned, is the same, which they develop due to stroke or motor neuron disease. I hope that it will be helpful for those who experience this situation. Do look out for more videos in the future.